Hello, class. Now, today we continue with the social anthropology, how culture and other structures within society influences people's behavior towards diseases or illness, or how they use their own cultural experiences to explain illness or health. These are some examples of some lay beliefs. The so-called lay people, the root grass people, or the say here we say the unprofessional, those that are not professional health providers or practitioners. According to Bluhagen, he demonstrates a range of lay beliefs about illness causation in relation to hypertension, high blood pressure among men, how people, in some of these communities, especially in some undeveloped and some of the developing countries, wherein they are still dealing with traditional healings, still dealing with trying to understand the notion of what causes one to be sick. Most of the time, their reasons are more external, not really biological or internal. So a good example, this situation here, wherein they according to Blohamgen in 1980 demonstrates a range of lay beliefs about illness causation in relation to hypertension, which is commonly known as high blood pressure amongst men. For example, one patient cited family argument as the cause leading to symptoms such as blooming veins, dizzy spells, and flashing lights. He argues that folks' beliefs cannot be entirely separated from formal medical ones. Individual illness beliefs can be inconsistent and change rapidly. See, now here it just shows how complex this, when it comes to really dealing with people's beliefs, how difficult at times it can be. That is what they believe. It's not because of other chemicals or high cholesterol or dealing with, even though here you can say, okay, having an argument with a family member can raise your stress level. And at times when stress levels are raised to a certain point, can lead to some of these situations. But for them, they are not blaming the stress. They are blaming the argument. So again, these are things that people have to be aware of. What are people's definition of what makes them sick? You have to understand that. And from that, you can walk through, explain to them that, yes, this could be, but there are other ways in which we can explain some of these situations. What do lay people's beliefs mean? They help people to make sense of their illness experiences. You see, we, most of the time, we try to explain ourselves, provide explanations for our experiences. And most of the time, some of those experiences make sense, others can be just as doubtful. But again, even though it does not make sense to you as a practitioner, you have to respect those beliefs. And you walk with those people, you walk with them, you start with them from where they are. Then you bring them to where you want them to be, explain to them some of the possible medical reasons, and see how best you can move forward for them to accept possible interventions. They influence illness behavior. What food we eat and the attitudes we believe we should exhibit in order to recover. Say at times again, what food we eat and the attitudes we believe will help with the healing process. None of this should be ignored, upright. But again, the food we eat, certain foods, maybe the food can be infected. Food can be the wrong type of food that our body needs, or too much of it. Say, for instance, how much in certain communities do people rely on fried food? Again, fried food has its disadvantages towards health, especially in certain minority communities. Fried food is considered good food, good eating. Or when you talk about, say, the South, most of the time is okay, people in the South like certain food types and whatnot. Again, that's their culture. You go in there because you have discovered other new things and just say, okay, stop doing this, stop. Will never get you anywhere. But you go there and you start slowly developing ways in which you can help them to address their health related issues. They influence ideas about illness causation. The food we eat and our attitude most of the time can contribute. Different type of illnesses. Negative attitudes usually don't help much. And not eating food that are properly sanitized or clean, washed, because again, some of those foods can introduce germs into our system. They influence attitude to treatment. Medical anthropology has investigated the use of both medical and alternative treatment, and why these are used in a number of different contexts. So you have, depending on certain cultural situations, you have alternative treatment. This is those sort of treatments that do not involve the medical process. Acupuncture, meditation, and yes, witchcraft, voodoo. These are all alternative treatment that people use. The way in which illness is treated ultimately depends upon how it is culturally understood. That's just the way the illness is treated ultimately depends upon how the culture, how that disease is culturally understood. Same with medical. The treatment used for medical illnesses diagnosed by medical means are treated based on the outcome, the data after the diagnosis, what is found. The way people get to those conclusions vary, and at times, but the outcome most of the time leads to the sort of treatment that is offered. And in most cases, with alternative treatment, in most cases, for some, it works, others, it doesn't work for certain illnesses. Just like with medical treatment, it's not all medical and treatments that are really treatable. There are some that are controlled. So illness is some illness in some cultures is believed to be caused by external forces, especially in developing countries. And some of those external forces are evil spirits and possession resulting in treatments as ritual based. So people that are possessed by evil spirits or evil, they are possessed by evil spirits. The treatments they go through the ritual based, including ceremonies to drive away the spirit. They conduct ceremonies. There are certain times wherein you can have the priest or the witchcraft, the leader, who can administer certain potions or certain do certain acts. And there are certain times wherein you take the entire family or the entire community to be part of that ritual. And at times involves killing of animals, offering sacrifices to the ancestors. Because again, most of the time, if it's not evil spirits, there are certain times wherein the cause of the disease might be, okay, the ancestors are not happy with you, and therefore you're sick. So you have to atone, you have to ask for their forgiveness. So these are all things that, especially if you go to developing countries and you start talking about why people are ill and this, they will always give you certain reasons. And most of those reasons are external reasons. But in reality, if you use the medical approach, you'll find out that these are caused by microbes, chemical imbalance, certain other issues that are taking place within the body, not external forces. Western medicine works within the biomedical model and is individualistic in treatment approach. You see, in certain culture, The treatment approach is communal, it's group. Medical is individualistic in treatment. This tends to lead to a curative approach based upon the diagnosis of the disease. The medical and approach usually, when somebody is experiencing certain symptoms, the doctor or the practitioner conducts certain diagnostic activities or try to diagnose the disease. And because of the volume, the amount of experiments that have been conducted dealing with trying to determine the characteristics of certain diseases, they try compare whatever they've discovered to prevailing diseases, and in some cases, the outcome is as easy as it can be. Seeking treatment from professionals is, however, not the first step in many cultures, as individuals often self-medicate prior to this. Now, this is not only common to developing countries. This is also a situation even in developed countries. People self-medicate, and most of the time by self-medicating, depending on the type of illness, you can either make it worse because you allow the infection to stay longer within your body to continue to infect, infect or affect other areas. So self-medication is one approach, but usually it's not the best approach. Is when one experiences symptoms, they should go for medical diagnosis so that they get the appropriate form of treatment. But in most cases, some of these things are easier said than done because for some people, access to medical care is a challenge. Don't have the means, don't have access to it, or don't have the way to seek medical. So most of the time, they rely on their own self-medication. And in most cases, it just makes things worse. So again, as we're continuing to really talk about some of these issues that we are dealing with right now, even with this COVID virus, I'm sure some people experience these conditions early. They try to see how best they can help themselves self-medicate rather than going to the hospital. And by the time they went to the hospital, it was too late. And at times, some of this is no fault of theirs. It's just lack of opportunities. So as we're talking about this holistic health or trying to help people improve their health, these are some of the issues also that we can. If we want everybody to really follow the medical model, we should also make sure that people really have the opportunities to engage the medical model. Many languages do not contain a word to describe cancer, yet this does not indicate that it does not exist. People try to explain it one way or the other. Again, they use their own experiences to explain it. And most of the time, depending on the situation, it it can They would, since they explain it one way, they'll try to treat it this other way. But most of the time, the outcome is usually not good. Usually, it leads to early death. The Herman Hellman or Hillman argues that some diseases, especially those that are difficult to treat, explain, and control, become symbols for more general anxiety that people have. And most of the time, when people really don't understand the disease or difficult to treat, it lends itself to more general anxiety because they don't know. And they start wondering, why is this? Why this? What have I done? Or this? So most of the time, it's some diseases are easily explained and can be treated, others are not. Especially when you talk of things like cancer, when people don't know a word to describe it. Some conditions become more than just disease, they become metaphors. You see, wherein now they use the disease in place to explain the gravity of a situation, and as a result become stigmatized. Illness metaphors. In the West, cancer is perceived as an uncontrollable, evasive, and shameful disease. And these views affect both health seeking and behavior, with patients fearful of a cancer diagnosis. People don't want to be told that, oh, you have cancer. So what happened? Because of the shame, because again, some people just stay away from you, even though, okay, you are not infectious. You cannot pass on that disease to another person. But they create that kind of shame, that kind of situation wherein you feel as if you have done something wrong. And in short cases, people stay away from diagnosis. And when it comes with to cancer, the longer you stay away from being diagnosed, the higher the chances for the cancer to spread within the body. And when it spreads within the body, it's very, very difficult to control. And most of the time, it leads to death. Cancer is still often used as an adjective in the media to describe an array of problems, such as drug use, wherein people say, oh, drug use is cancer into the society. Migration is cancer to the society. And crime, because it is slowly eating away the society as cancer slowly eats people that are infected with it. The same with AIDS is often negatively described metaphorically too, associated with pollution and also as, with stigmatization. Culture and mental illness. Medical anthropologists demonstrated that there are no universal category of mental illness across cultures. Say in the Aboriginal culture, notion of longing for, crying for, and being sick for their country have exactly the same symptoms based as depression. So most of the time, again, depression is root cause of depression is varied. Some of it can be the blood chemistry. Some of it can be triggered by a sense of loss, a sense of hopelessness. And here it's about the same. The Aboriginal people, when they long for their country, they cry because, again, when you think of how some of these natives have been deprived of their country, people have come taking over, and yes, they long for their country, and you've lost something, and they experience that sense of loss. Even native Indians in America, some of them could be described as having those sort of same feelings because they've lost their country. Research has also shown differences in understanding in relationship to schizophrenia. In some cultures, hallucinatory behaviors and suspiciousness are not necessarily seen as signs of mental illness. Most of the time are seen as again some of those external forces being bewitched, being that, and so in most cases there is a lot of education that needs to be done, to help people understand some of these different differences. Different cultures encourage certain personality types: assertiveness, ego strength, optimism, and humor. Great things. People usually who are strong, ego, it's great. But to what extent do you really maintain that as a positive behavior? Optimism, you have to be optimistic, but at the same time, you also have to be realistic. You see, all of these are very good qualities. Type A personalities, drive. And yes, you have to have humor. People with humor who can make fun of themselves once in a while, not taking themselves too seriously, have a better way of dealing with mental issues. Mental health problems are heavily socially influenced. Feelings such as despair and hopelessness are located in individual brains, but are also related to pattern of interaction within families, communities, and indeed wider society. So one of the things that those situations wherein people become hopeless, sense of loss. See, and before people allow themselves to get to that, make sure you call people for help. Talk to people how you feel, because how you feel to a good friend will tell you to seek help or may help you explain the situation better, because most of the time you get into a fog wherein you really everything seems so big beyond your control. There are certain times things don't always appear that way. You have to use society, you have to use the resources, you have to talk to people, especially those people you trust. You seek help. There are a lot of hotlines that are dealing with health related issues. So you should always make sure that those things are used. And alcoholism is one of those other issues wherein alcohol is one of those. We use alcohol for a lot of societal issues. We use alcohol in church. We use alcohol in different settings. And great as they may appear, alcohol can also be a source of problem. So most of the time it is extremely important that people drink in moderation. Men and women processes alcohol differently. Women should drink less than men. And especially when women are within the reproductive age should avoid excessive drinking. And worst of all, if they are pregnant, should not drink alcohol because that will directly impact the developing baby. That can lead to alcohol syndrome. And yeah, there are certain cultures that encourages drinking or they drink more. And with drinking comes a lot of other health related issues, sclerosis of the liver, different types of cancers, and at times accidents and sudden death. Drinking among students, those again should be discouraged. Binge drinking too much in a certain short period of time can lead to alcohol poisoning, and that can kill. And quite a few young men have died through the years because of hazing in some of these cultural practices or communities or societies. Again, there are certain behaviors within and say the Western culture wherein people engage in certain behaviors, sunbathing, sun tanning boats, which can lead to cancer. They do it for wanting to look brown so that I look healthy, but in reality is I believe that is going to lead to their early death or a lot of punishment. Certain culture also respect being big, meaning that the bigger you are, the obese you are, the wealthier you are, the more as an individual. Again, obesity is completely against good health because forget about being obese can lead to heart related issues, joints, and other forms of cancer, diabetes, you name it. But certain cultures, they start as seeing it as great. But if the more they know about it, they hopefully they would realize that being obese is not good for health. In some, even though it might be good for image, but it's not good for your overall health. Western cultures in general, Western culture is generally damaging to health. This idea of materialism, individualisms are detrimental to health and well-being because of their impact on psychosocial factors. The 24-hour, round the clock, people don't sleep, stay on the phone, stay on the net, say, do this, so many activities. Again, that in itself will impact your health negatively. You have to have time to sleep at least 7 hours a night so that the body can replenish or repair itself. Not sleeping can lead to a lot of other issues, can lead to heart problems, hypertension, can lead to some intentional accidents, and it's just not good. 24 hours is there, but you as an individual try to use 12 hours of those for real meaningful work, at least 7 hours or 8 hours for sleep so that the body can refresh itself, ready to be more productive the following day. Again, here are some of these key things that you have to also be mindful of. It's the medical anthropology is a subdiscipline of social anthropology that demonstrates the importance of culture as a determinant of individuals' understanding and experiences of both an illness and treatment. Say culture as a determinant of individuals' understanding and experiences of both illness and treatment. Medical anthropology, when critically when when critically and when critically analyzing health, has strongly demonstrated that health is overwhelmingly social, with culture as a key determinant of health beliefs, behaviors, and treatment. Anthropology shows that health and illness are culturally located and that key social and cultural meanings are associated to health. At the end, our culture, our society plays a good role in determining how we understand what makes us sick and what sort of treatment we seek. And again, culture, what cultural structures we have in place, what cultural beliefs we promote will also determine what sort of health services or healthcare that the people in that culture will seek. Okay, we end class here, and we're done with chapter 5. Start getting ready for possible and the midterm exam. But I'll